Have you ever looked in the mirror and thought, I feel fine, so my kidneys must be healthy? It's an easy assumption to make. After all, when something is wrong with your heart, you may feel chest pain. When you catch a cold, you usually notice a cough or fever. But your kidneys are different. They can lose a surprising amount of their function before they cause obvious symptoms. In fact, many people don't realize there's a problem until the damage has become much more serious. That's why doctors often refer to kidney disease as a silent condition. The encouraging news is that your body sometimes gives subtle warning signs before the problem becomes severe. The challenge is knowing what to look for and understanding which symptoms deserve a conversation with your healthcare provider. Today, we're going to explore 8 silent kidney damage symptoms that adults over 60 should never ignore. Some of these signs are surprisingly common and can easily be mistaken for normal aging. Others are much less obvious than most people expect. Be sure to stay with us until the end because the final symptom is one that many older adults dismiss as simply getting older, when in reality, it may deserve medical attention. Let's begin. Your kidneys are 2 bean-shaped organs located near the middle of your back, just below your rib cage. Although they're relatively small, they perform some of the most important jobs in your body. Every day, your kidneys filter waste products and excess fluid from your blood. They also help control blood pressure, maintain the right balance of minerals like potassium and sodium, support healthy red blood cell production, and help keep your bones strong by activating vitamin D. Think of your kidneys as your body's natural filtration system. When they're working well, they quietly do their job without drawing attention. But when they begin to lose function, waste and fluid can gradually build up inside the body. As we age, kidney function naturally declines a little, even in healthy people. Conditions such as high blood pressure, diabetes, heart disease, obesity, smoking, and certain medications can increase the risk of kidney damage even more. That's why regular medical checkups become increasingly important after age 60. Now, let's look at the first silent warning sign. The first symptom is swelling in the feet, ankles, or lower legs. Have you ever taken off your socks at the end of the day and noticed deep marks around your ankles? Or perhaps your shoes suddenly feel tighter than they used to. Many people blame swelling on standing too long or hot weather. Sometimes that's exactly the cause. But persistent swelling may also happen when the kidneys aren't removing excess fluid as effectively as they should. Imagine filling a sink with water while the drain slowly becomes clogged. At first, everything looks normal, then the water begins to rise. In a similar way, when the kidneys struggle to remove extra fluid, some of that fluid can collect in the tissues of the body. Gravity causes much of it to settle in the feet and ankles. The swelling may be mild at first. Perhaps your rings feel tighter, your socks leave deeper marks, or your shoes don't fit quite the same by evening. It's important to remember that swelling has many possible causes: heart problems, liver disease, certain medications, vein disorders, and even sitting for long periods can all contribute. That's why swelling alone doesn't diagnose kidney disease. But if it's new, persistent, or getting worse, it's worth discussing with your healthcare provider. The next warning sign often appears in one of the most ordinary parts of your daily routine: going to the bathroom. The second symptom is changes in urination. Because the kidneys produce urine, changes in bathroom habits may sometimes provide important clues about kidney health. You may notice you're urinating much more often than usual, or much less. Some people wake up several times during the night to urinate, even though that wasn't their normal pattern before. Others notice urine that's unusually foamy. Foamy urine can occasionally happen after urinating quickly, so seeing bubbles once isn't necessarily a reason to worry. However, persistent foamy urine may sometimes suggest that protein is leaking into the urine. Protein is an important building block that the kidneys normally keep inside the bloodstream. When the kidney filters become damaged, small amounts of protein may escape into the urine. Another change worth paying attention to is blood in the urine. Sometimes it's obvious. Other times it's only detected during a laboratory test. Regardless, blood in the urine should always be evaluated by a healthcare professional because it can have many possible causes, including kidney disease, infections, kidney stones, or other urinary tract conditions. If you notice major changes in your urination that continue for several days or are accompanied by pain, fever, or blood, don't ignore them. The earlier the cause is identified, the more treatment options may be available. As important as urination changes are, the next symptom often catches people completely off guard because it doesn't seem related to the kidneys at all. The third symptom is ongoing fatigue and low energy. Everyone feels tired now and then. Maybe you had a poor night's sleep. Maybe you've been especially busy. That's perfectly normal. But fatigue related to kidney disease is different because it tends to linger. It doesn't improve very much with rest. You wake up tired. You feel tired throughout the afternoon. Even small activities seem to require more effort than they used to. Why does this happen? Healthy kidneys produce a hormone called erythropoietin. That's a long word, but its job is simple. It tells your body to make red blood cells. Red blood cells carry oxygen throughout the body. When kidney function declines, the body may produce fewer red blood cells, leading to a condition called anemia. Anemia simply means there aren't enough healthy red blood cells to deliver oxygen efficiently. As a result, you may feel weak, tired, or short of breath during everyday activities. Of course, fatigue has countless possible causes. Poor sleep, thyroid problems, depression, infections, medication side effects, and many other health conditions can also leave you feeling exhausted. But if your fatigue is persistent, unexplained, or becoming worse over time, it's worth discussing with your healthcare provider. Sometimes a simple blood test can help identify the reason. And speaking of blood tests, the next warning sign often appears long before a person ever notices physical symptoms. But there is also one physical clue that many people experience, and surprisingly, it often shows up while they're trying to sleep. The fourth symptom is persistent itchy skin. At first glance, itchy skin doesn't sound like a kidney problem. Many people assume it's caused by dry weather, allergies, soap, or aging skin. Often that's true. But when the kidneys lose significant filtering ability, waste products and mineral imbalances can build up in the body. These changes may contribute to persistent itching in some people, particularly as kidney disease becomes more advanced. Imagine applying lotion every day, changing soaps, and still feeling itchy for weeks without a clear explanation. The itching may occur on the arms, back, legs, or across large areas of the body. It often doesn't come with a visible rash. That's one reason people sometimes dismiss it. It's important to remember that itchy skin is far more commonly caused by conditions like dry skin, eczema, allergies, or medication reactions than kidney disease. But if the itching is persistent, widespread, and accompanied by some of the other symptoms we've discussed today, it deserves medical evaluation. By now, you've probably noticed a pattern. None of these symptoms proves that someone has kidney disease. That's exactly what makes kidney problems so difficult to recognize. The warning signs are often subtle. They're easy to blame on aging. They're easy to ignore. But we're only halfway through the list. Coming up next, we'll cover 4 additional warning signs that many people never connect to their kidneys, including one symptom that often appears during meals and another that some people notice every morning when they wake up. Those clues may be even more important than the ones we've discussed so far. Let's continue with the remaining silent warning signs. The 5th symptom is a loss of appetite or feeling nauseated more often than usual. Have you ever looked at a meal you normally enjoy and simply didn't feel like eating? Or perhaps you've noticed a metallic taste in your mouth that makes food less appealing. While occasional changes in appetite happen to everyone, a persistent loss of appetite deserves attention. As kidney function declines, waste products that are normally filtered out of the blood can begin to build up. This may affect the way food tastes and can sometimes lead to nausea or a reduced desire to eat. Imagine someone who once looked forward to breakfast every morning. Over several weeks, they begin skipping meals because nothing sounds appealing. Family members may notice they've lost weight without trying. Of course, poor appetite can also be caused by stomach problems, infections, medications, depression, or many other medical conditions. That's why this symptom should never be used to diagnose kidney disease on its own. But if a reduced appetite lasts for several weeks, especially when combined with fatigue, swelling, or changes in urination, it's a good idea to speak with your healthcare provider. And speaking of things people often overlook, the next symptom frequently appears at night and is commonly blamed on getting older. The 6th symptom is frequent muscle cramps. Have you ever been awakened by a painful cramp in your calf or foot? Muscle cramps become more common as we age, and they often result from dehydration, overuse, or sitting in one position for too long. However, kidney problems can sometimes contribute as well. Healthy kidneys help maintain the right balance of important minerals such as potassium, calcium, sodium, and magnesium. These minerals allow your muscles and nerves to work properly. When those levels become unbalanced, muscles may cramp more easily. Picture your muscles like an electrical system. If the wiring receives too much or too little of certain minerals, the signals don't travel as smoothly. That can sometimes lead to cramping, twitching, or muscle discomfort. The key point is that occasional muscle cramps are very common and usually aren't caused by kidney disease. But frequent, severe, or worsening cramps, especially when accompanied by several other symptoms we've discussed, are worth mentioning during your next medical visit. Now, here's a symptom that many people never connect to kidney health because it affects the mind rather than the body. The seventh symptom is difficulty concentrating or feeling mentally foggy. Most of us occasionally forget where we left our glasses or walk into a room and forget why we went there. That's a normal part of life. But persistent confusion, difficulty concentrating, or unusual mental fatigue may sometimes occur when kidney disease becomes more advanced. Why? Because healthy kidneys remove waste products from the bloodstream. If those wastes build up over time, they may affect how the brain functions. Some people describe it as feeling unusually sleepy, struggling to focus, or finding it harder to complete everyday tasks. Imagine trying to read your favorite newspaper, but realizing you've read the same paragraph 3 times without understanding it. Or perhaps balancing your checkbook suddenly feels much more difficult than it used to. These changes can also result from many other conditions, including poor sleep, medication side effects, vitamin deficiencies, thyroid problems, depression, dehydration, or memory disorders. That's why it's important not to jump to conclusions. Instead, think of brain fog as one possible clue that should be considered alongside other symptoms and evaluated by a healthcare professional. Now, we've reached the final warning sign. Ironically, it's one that many people see every morning, but rarely think much about. The 8th symptom is persistent puffiness around the eyes. Have you ever noticed that your eyelids seem swollen when you wake up, even after a good night's sleep? A little puffiness first thing in the morning can be completely normal. It often improves within a short time after getting out of bed. However, puffiness that becomes persistent or noticeably worse may sometimes occur when the kidneys are leaking protein into the urine. Earlier, we talked about foamy urine. Both symptoms can be linked because protein helps keep fluid inside the blood vessels. When too much protein is lost, fluid may move into surrounding tissues, leading to swelling in areas like the eyelids. Again, there are many other possible explanations. Seasonal allergies, lack of sleep, sinus problems, certain medications, or simply the natural aging process. But if puffiness around the eyes is accompanied by swelling in the legs, changes in urination, fatigue, or high blood pressure, it's worth bringing up with your healthcare provider. Now that we've covered all 8 warning signs, let's talk about something even more important. How can you help protect your kidneys? Fortunately, many of the same habits that support your heart also support your kidneys. The first is keeping your blood pressure under control. High blood pressure is one of the leading causes of chronic kidney disease. If your healthcare provider has recommended medication or lifestyle changes, following that plan is one of the best ways to protect both your kidneys and your heart. The second is managing blood sugar if you have diabetes. High blood sugar over many years can gradually damage the tiny blood vessels inside the kidneys. Regular monitoring, healthy eating, physical activity, and taking medications as prescribed can all play an important role. The third is staying hydrated. Most healthy adults benefit from drinking enough fluids throughout the day, although individual needs vary. People with certain heart or kidney conditions may be advised to limit fluids, so always follow your healthcare provider's recommendations. Fourth, be cautious with over-the-counter pain relievers. Medicines such as ibuprofen and naproxen, known as nonsteroidal anti-inflammatory drugs, or NSAIDs, can affect kidney function, particularly when taken frequently or in high doses. If you regularly rely on pain medication, ask your healthcare provider which options are safest for you. Fifth, don't smoke. Smoking reduces blood flow throughout the body, including to the kidneys, and increases the risk of both heart disease and kidney disease. If you smoke, quitting is one of the most valuable steps you can take for your overall health. Sixth, stay physically active. You don't have to run marathons. Even a daily walk, gentle cycling, swimming, or chair exercises can help support healthy blood pressure, improve circulation, and reduce the risk of chronic disease. Seventh, eat a balanced diet. Focus on vegetables, fruits, whole grains, beans, lean proteins, and healthy fats, while limiting highly processed foods that are often high in salt and added sugars. These simple choices support not only kidney health, but also heart health, brain health, and healthy aging overall. Perhaps the most important habit of all is scheduling regular medical checkups. One challenge with kidney disease is that you can feel perfectly healthy while kidney function is quietly declining. Simple blood and urine tests can often detect problems long before symptoms become severe. If you're over 60, especially if you have high blood pressure, diabetes, heart disease, or a family history of kidney problems, ask your healthcare provider whether kidney function testing is appropriate for you. Early detection often provides more opportunities to slow progression and manage underlying conditions effectively. Before we finish, let's quickly review today's 8 silent warning signs. Persistent swelling in the feet or ankles, changes in urination, ongoing fatigue, persistent itchy skin, loss of appetite or nausea, frequent muscle cramps, difficulty concentrating or brain fog, and puffiness around the eyes. Remember, none of these symptoms automatically means you have kidney disease. Many have much more common and less serious causes. But when several occur together, continue over time, or seem unusual for you, they deserve medical attention rather than being dismissed as just getting older. Your kidneys work quietly every single day. They filter your blood, help regulate blood pressure, support healthy bones, and keep your body's fluids in balance. Taking care of them today may help you maintain your independence, energy, and quality of life for years to come. Thank you for spending this time with us. Now, we'd love to hear from you. How old are you? And which of these 8 warning signs surprised you the most? If you've discovered healthy habits that have helped you take better care of your kidneys, share them in the comments below. Your experience could encourage someone else in our community to take an important step toward better health. Take care of yourself, stay informed, and we'll see you in the next video.